Hi, I have a new environment here. This is my room. I'm sitting somewhere new. This is my view. It's such a pretty view. That's my backyard and I love it. My daughter's trampoline and some trees, and it's a nice big window, and I love this house. I went to Stanford on Tuesday and they almost didn't let me in because I had a sniffly nose. I spoke to the physician's assistant when I got there, and she said that they are so on lockdown when it comes to the masks, and they're really keeping people out that could potentially be sick. And so I had actually a dialogue with one of the other assistants before I got there, because I was only going to have some of the saline removed in this tissue expander. So it wasn't really a necessary appointment, but she did let me in. But she said, if you continue to feel that way, you should get COVID tested up where you are. I was tested on May 12th, and I'll be tested again when I go back down there on August 21st for surgery. It's intense, but at least I know what to expect because I've been through it once. So, and she ended up taking out 30 cc's, and I was thinking she was going to take out more, but I forgot that the expander, whatever it's made out of, probably some kind of hard plastic, it kind of can get edges on it, and so she was worried about there being edges on it and it breaking through my skin, because that's what happened on this side. I don't know if it had to do with the edges and the combination of having the thin skin on this side. Didn't want that to happen again, so she really only took out 30 cc's, and it's like a tiny bit squishier where it was like cement and hard as a rock. So it's nice that it's a little bit squishier, but I don't think my intention was to take pressure off the chest wall so that maybe it would help with the concavity that I know is going to happen. And I don't think it's doing that whatsoever, because it just hasn't taken enough pressure off. So that happens. My last video, I talked about bone pain, and I got a density bone scan Wednesday, and it turns out I have osteoporosis in my back and osteopenia in my left hip. And I've had it's so odd because I've had I'd say pretty consistent, moderate, severe pain in my right hip and my right knee for a while, since chemo. And I just thought maybe it's arthritis, I never really thought osteoporosis. I don't think they scanned my knee. I don't know how far, maybe they did. They did back and hips, because I think those are the most prone, vulnerable areas. So I don't actually know if they did the knee or not. But then 3 days before I got the bone density scan, I started getting pain in my left hip. So that was odd. Right when I got the pain, now suddenly I have osteopenia there. So I got what the T-score numbers are, and I looked that up, and it's something like -0.9 in the left hip, and then -3 in the spine, which is actually pretty severe. I don't even know if it gets greater than that. It probably does, but the scale that I showed was just maximum severe osteoporosis in the spine, and I'm pretty sure I have chemo to thank for that one. So just another one of those long-term side effects that is hard to really think about, because going through chemo and all the side effects, and there's so many side effects that are acute and right in the face. I got crazy acne, and even just, from radiation, just the crazy skin burning and peeling and pussing and stuff like that. So it's kind of I'm getting a hot flash right now. It's all those side effects that happen right then, and it's you just want to get through it. Get me through this, get me through it. Okay, phew, I got through it. And then there were the long-term side effects that I personally did not think about at the time, because I was just trying to get through the short-term side effects. But I know that heart disease and vulnerability in the rib bones, because this whole area was radiated all the way from here down, all the way to here. I have the tattoo here, here, and here, so that they could line up I forgot what that word is, but line up the angles, there's another word for it, to do the radiation. So I'm that part of my body that was radiated is now vulnerable, I think, for the rest of my life. And so that's one of those long-term side effects. So I've thought about it in terms of what's the condition of my heart. And I have some sort of slight arrhythmia that I'll go back to the cardiologist in September or something. You know, finding out I have osteoporosis is a bummer. I'm 45. It's not, you know, eventually that probably would happen, given that I'm not exactly petite, but I'm not that big either. So that's one advantage to having more weight on your body, is reduced risk for osteoporosis. So anyway, I now need to just really take my intake of calcium, and seaweed is great for calcium. I started eating raw egg yolks. Egg yolks are, according to some, the world's most perfect food. It has so much nutrition. As I understand it, the white is really just protein, and it is possible to have too much protein, but I kind of like dump out a lot of the white, not all of it, but most of it. And then I eat the egg yolk. This morning I had 4 egg yolks, and there's a lot of research showing that it's very good for you. And it's so weird that there's this whole cholesterol thing. And yeah, I mean, don't get me going on nutrition and all that. There's so many different points of view on it and schools of thought. But I personally, from what I've read, believe in the power of egg yolk. So, and you kind of have to increase gradually. It can make you have to run to the bathroom really severely at first. I'm not sure why, but there's like an adjustment that needs to happen. Got myself another kettlebell. I really need to be doing some more strength training, and I thought about going to the gym, and I was like, I don't want to do that. I'd rather just do it at home. So I've incorporated walking into my life. I've been doing about 6 days a week, and I aim for 6,000 steps, so I've been doing pretty good. I had a few days where I didn't, but I'm really kind of tracking the weeks and the months more than the days. So I'm making sure that week by week and month by month my steps increase. And I'm going to start adding in the weight training. Well, I've been doing it, but I'm going to create a program. I'm going to create like something that's 15 minutes a day that is really doable, that I know I can stick to, and recognize that I need to take it seriously. If my back is at a -3 in the T-score right now, like what would it be in 20 years if I didn't do anything about it? I might even break my back and not even think that I was susceptible to that, because I've actually had a really healthy, strong spine for my whole life. Pre-chemo, I did yoga for years, decades even, and I just was always so proud of my spine. It was just like so fluid and juicy and never hurt at all. And just recently, then I have this lipoma in my lower spine, and I have no idea what that's from, but I know that people can just get those. And then now I've started to have a little bit of the back pain. So, and I think I've shrunk a bit too, which would parallel and make sense with osteoporosis, so the bones are just kind of constricting slowly over time. So I'm on the NPlate for the ITP, and that I'm at 8 micrograms per kilogram right now, and the maximum is 10. I started at 1, and each week they keep increasing my dose. My platelets on Wednesday were, last week they were 31,000, and I think this week they were 33. And when I spoke to the doctor's office, I thought it was kind of funny, because his nurse called and said, your doctor, I'm not gonna say his name, your doctor said that it looks like the NPlate's working, and let's stick with it and see if it works, because I don't know, I just think it's funny. I'm like, I told her, well, it's working is relative. If you consider 31, it's working, really, like the range is 150 to 450 or 150 to 400, I think 450. So 33 is like, it's not 0, but it's not 150 either. That was just kind of a funny thing, and I guess we're gonna see it through, but there are a couple other things I could do, and I did ask them about it. I think my next plan of attack would be Rituxan, which is a former leukemia chemo, I believe. I don't know if they use it anymore, but at the top on the NPlate, I asked the pharmacist the other day if they had any patients there at the hospital who were receiving NPlate at that higher range, and she said no. Most people, it works for them in the 1, 2, 3, 4 range, and I'm already up to 8. So I don't know how I feel about being at the very top. I'm glad it's working, but let's see what happens when we get my blood checked on Wednesday. The other thing, and this is super sad, I've had this EMDR. EMDR is like, I always forget what it stands for, and I'm not going to try to figure it out, but it's one of those like things that they do. It's a type of therapy that they do for people who have undergone traumatic experiences. Going like this because you hold these things in your hands, and it has a vibration effect, and it also has an audible sensory effect. We really only did that process twice together, and mostly she was just sort of a talk therapist for me, but she really was the one who, I went to her for maybe 2 years, I think. I went to her because I had been approaching all of the cancer stuff from every viewpoint, like physiological, via my food, via my lifestyle, just like all the different things. And then I hadn't really dealt with the emotional component of it. So I thought, okay, well, I don't really know what I have to heal in specific. You know, I could always talk about various things that were unfortunate in my life, but that's not really how I'm wired anyway. I usually don't focus on that stuff. Anyway, I went to her and we definitely uncovered a bunch of stuff, you know, a bunch of childhood stuff, a bunch of current stuff, like my tendencies and toward the people who I'm attracted to. Really, she was just my sounding board, especially for all the stuff that I've gone through with cancer. And she's the only person who knows kind of like everything about my life. Like, we would have been friends if we hadn't met there, and maybe we will be friends now because now I don't get to see her anymore. I was a little bit stunned by it yesterday, like I was a little shocked, and I realized, well, I have to find somebody else now, but really useful having that as part of my healing process. Another thing that's been part of my healing process recently is a friend of mine that I know through Landmark Education, something I've been involved with for many years and love deeply in my heart. It's like divine light. She gives me light, and it's for the purposes of healing, really. And she's given me this divine light twice. I was supposed to attend something on Sunday to be able to just be in the space with those people, be in the space with light practitioners. And this is not a language that I usually, at this point in my life, even though I'm from California, I'm not like one of these kind of woo-woo spiritual new age people. I like 2 feet on the ground, practical approach to life. I like things that are tangible. I like things that I can do that are right in front of my face. I think if you're not dealing with what's in front of you and have 2 feet on the ground, then you have no business talking about 5th dimension and ascension. You know, if you can't pay your bills, clean your room, and have healthy relationships with the people who are right in front of you, then like get out of the 5th dimension and come back to the 1st dimension and deal with yourself. So anyway, I guess that's a little bit of me preaching on the pulpit, but all that to say that I feel very excited about my relationship with this friend of mine and that community of people and receiving this light, because I had really beautiful experiences with it when she was giving me light in my heart, in my third eye, in my head. She asked me other parts of my body, and I could feel that it was what I needed. I could feel, because I just can get really caught up in the doing of life. I'm running a business. It's a new business, so it's a lot of work starting a new business. I have 3 appointments on Mondays with doctors. Like, I am very scheduled with doctors, and I'm a single mom half the time. I spend my time running around a lot, and it feels so good to just receive and lie there and have somebody give to me their sweet, loving, healing energy. So I've added that into my protocol as well. And yeah, thanks for watching, and appreciate it. If you're not a subscriber, please become one. I would love to have 1,000 subscribers. Once you get to 1,000 subscribers and a certain number of watch minutes, YouTube actually pays you, and it's not a lot at first for somebody with 1,000 subscribers, but it can build from there. So if you find the video useful or like that, please share it, please subscribe, like the video, and all of that. I appreciate it. Take care.